we're gonna leave that last, okay? So we're gonna start with 1078. So Erin, can you tell us what the bill does? And we'll take it from there. I think we have all the members except two of them. Thank you.
House Bill 1078 was held over from the last meeting. Delegate Panamonik, you wanted to add to the commission's study to require them to consult with one representative from the Maryland Hemp Coalition and one representative from the Maryland Health Alternatives Association. So that consultation has been added to the study, and that's in the reprint that was provided. Another issue that was raised in the last meeting was prohibiting individuals under the age of 12 from purchasing or selling a product containing Delta 8 or Delta 10 tetrahydrocannabinol. So there was a amendment sent on House Bill 1078. There's a separate piece that would go to Section 10(113) of the criminal law article. That was sent to you separately. So this would be a new provision in the criminal law article that would read: a person who distributes products containing Delta 8 or Delta 10 tetrahydrocannabinol, including a person licensed under Title 16, 16.5, 16.7, or Title 17 of the Business Regulation Article, may not purchase for or sell a product containing Delta 8 or Delta 10 tetrahydrocannabinol to an individual under the age of 21 years. In a prosecution for a violation, it is a defense that the defendant examined the purchaser's or recipient's driver's license or other valid identification issued by a government unit that positively identified the purchaser or recipient at least 21 years of age. There's also provision that provides that any website owned, managed, or operated by a person who distributes or sells a product containing Delta 8 or Delta 10 tetrahydrocannabinol shall employ a neutral age screening mechanism that verifies that the user is at least 21 years of age, including by using an age gate, age screen, or age verification mechanisms. And the penalties for violation would subject to an individual to a conviction or fine not exceeding $300 for a first violation, $1,000 for a second violation, and $3,000 for a subsequent violation.
Delegate Shalega has a question, and then Delegate Robin Lewis.
Thank you, Madam Chair. I see Barry Pritchard is on here. I just want to check with him. Barry, none of the CBD stuff is going to get thrown into this prohibition under 21.
Great, thank you.
Is that true? I'm asking. I don't know. You're the chemist.
I haven't had a chance to read it that closely, but it doesn't appear to affect CBD. So
you guys aren't doing the Delta 8 or 10. That doesn't affect you at all.
No.
Okay, great. That's my question. Thank you.
Thank you.
Delegate Lewis.
Thank you, Madam Chair. It's been a long time since I got carded, so I don't understand what neutral age screening mechanism means. What does that mean?
So this is modeled after a similar provision in the Medical Cannabis Commission statute. Will Tilburg's on the call if he could. I'm sure.
What is a neutral age screening mechanism? What does that mean?
1 second.
Is it like counting the rings
Tilburg?
on a tree or something?
Good morning, members of the committee. Delegate Lewis, so that's specific for websites. So there are a lot of the retailers that are selling these products, it's online. And so it's when you go to the website and it says you have to be over 21 and enter your birthday is what that's referring to. So it's very common for alcohol, tobacco, cannabis and adult use states that they employ those mechanisms and use that language to express it.
Got it. Thank you. Thank you, Madam Chair.
My pleasure. These are all good questions. Anyone else? Does anyone else have any questions or concerns about the bill? I know that some of you wanted me to put in the bill just straight, but I think we need to work with the industry and people like Mr. Pritchard and others and get this right in the interim. So we just got to do it slowly. And this is a compromise. Delegate Johnson.
I wanted to thank you, Madam Chair, for putting that age provision in. While we don't want to hinder any of our industries, we also want to protect our kids. So I appreciate it.
No, my pleasure. And again, thank you, Delegate Shalega. May I have a second, please?
Second.
All those in, any questions or concerns about the amendment? All those in favor say aye. Any
Aye.
opposed? None. On the bill as amended, may I have a motion? May I have
Second.
it's been moved and second by Delegate Shalega and Delegate Hill. Any questions or concerns? All those in favor say aye.
Aye.
Any opposed? None. The bill passes. And Delegate Belcastro and Johnson, thank you so much for your suggestion regarding the age. Okay? Appreciate it. Next, we have House Bill 1381.
Madam Chairman,
Aaron,
this is Barry Pritchard. I just want to thank everyone for taking the time to consider my testimony and viewpoint. So thank you again.
oh, our pleasure. Thank you for being here. And, you know, it makes the bills better and we welcome it, okay? Have a
Great.
blessed day. Aaron, what does 1381 do?
I sent you a reprint of 1381 that represents consensus amendments on the bill. The bill provides that oriented strand board means a multi-layered board that is made from strands of wood together with a binder by the application of heat and pressure, with the strands in the external layer primarily oriented along the strength axis of the panel in accordance with the U.S. Department of Commerce Voluntary Product Standard PS 2-18 Performance Standard for Wood Structural Panels, and intended to be used as a covering material for roofs, subfloors, and walls when fastened to supports. There is a new amended provision that says that the section does not apply to the manufacture, sale, or distribution of products or materials that contain oriented strand board for purposes outside of firefighting training purposes. The bill provides that a person may not set on fire or burn oriented strand board for firefighting training purposes. There's also a penalty provision that states that a person who violates the section is subject to a first violation, a civil penalty not exceeding $500, and for a second or subsequent violation, a civil penalty not exceeding $1,000.
Okay, Pat Young, Delegate Young, I'd like you to please tell me who did you work with regarding these amendments? Who's on board, okay?
Yes, ma'am. So worked with the firefighters and worked with the folks that were representing the, I guess, the chemical manufacturer. Sorry, I don't have the exact name right in front of me. We went back and forth for a bit, but we wanted to make sure that the intent of the bill was intact, but also keeping the original or as close to the language that we could get from the Virginia bill into a Maryland statute, and the amendments that those discussions where it was in language.
It is hard to hear you. Can you try that again? You said that you work with the firefighters, with the chemical industry, and are they on board?
They are on board. Yep. And the amendments were the consensus amendments that everyone agreed to.
So everyone is on board. No one is objecting to it.
Yes, ma'am.
Okay, and this, go ahead.
Yes, ma'am. There were the woodworkers or the representatives from the wood industry had made comments, but they never reached out. They had testified against it, but they had told us beforehand that they were in favor. They never reached out about or responded back to questions to clarify. So we got everybody that we could talk to on board with the bill as it is now.
Okay, and this is model after Virginia?
Yes, it is.
All right. Jeff, Bottle, would you like to be heard why we need this bill?
Yeah, I think that Delegate Young really summed it up fine. I think that the last provision that was put in, the last amendment on the that just says it doesn't restrict the use of it outside of fire training activities. That piece of it satisfied the Woodworking Council's concern. This is this is something that just came up within the last couple of years, where OSB is on its face is not a harmful product, but when you burn it, it's really, really bad for our firefighters. I did upload in the original testimony on written a whole bunch of the scientific information and stuff about just a lot of the biomarkers and the elevated levels of bad stuff that gets into our bloodstream and our system when you burn it. So this bill is just, it's a very narrowly focused bill that says use OSB for whatever you want, just don't burn it for fire training because of the health impacts on our firefighters.
Nick Manis, are you on the call? I know that Nick McManus told me that everyone is good, including Wood. The
Yes, that's
Wood
correct.
people.
We did work with Nick Manis and the Word Working Council, and the amendments that were offered by Delegate Young are the consensus amendments, and everybody is on board with them.
All right, beautiful. Delegate Shalega.
Thanks so much. So yeah, it's just so you know, it is called OSB. And just for our committee, it's a plywood type of product because plywood's really expensive. Most people today use OSB for sheathing your house or putting it down as a subfloor before you put flooring down. My question would be this. First of all, the only people that do these firefighting trainings, aren't they just the counties that do it? Are there private companies that do firefighting training?
I think I think Delegate, I think it's a mixed bag. You know, primarily in the career departments, it's either the county or, in the case of Baltimore City, it's the city. But you also have individual fire companies that do training. And I think the attraction to the Oriented Strand Board, or the OSB for short, is it's so much less expensive than like regular wood or plywood. So it's there's an incentive to want to use it because of the cost savings, but the health effects on our firefighters are just really, really bad.
Okay, and then finally, would this preclude, do they still do controlled burn firefighting exercises of homes? I know they used to do that, where if a homeowner, was going to demo a house, they would offer it up to the fire department to use it as a training exercise.
Yeah.
Do they still do that? And if they do, look, most houses have OSB in it just because, as you said, it's so much cheaper than a sheet of plywood.
Yeah, no, that's actually a great question. I think the acquired structures is what we refer to them as for actually burning them, have become less common only because of the NFPA safety requirements, the instructor to student ratio. It's just really, and also the environmental impacts. It's really hard to find an acquired structure that you can actually burn. But where they use OSB in a house, it's typically found on the outer walls. It's found on the roofs where instead of using plywood, they use OSB. And then, they would apply the felt and the shingles on top of that. And it's also found in subflooring. If we were training in an acquired structure, we would not want to be burning subflooring. We wouldn't want to be burning the exterior walls, and we certainly wouldn't be wanting to burn the roof area above the, up on the roof. I mean, it's just not something that we would want to do for a safety issue. So we could still, this bill wouldn't prohibit any training within an acquired structure. And where you find the OSB inside a house, for example, it's just not something that we would be burning. We wouldn't want to burn the floor because we'd end up falling through it. You never want to burn the roof because that's just a hazard. And then, the outer walls are not something you're going to want to burn either.
Yeah, it sounds like you're not doing those kind of, with this bill, you couldn't do it because OSB is in everything. Underlayment.
Yeah,
So this would basically preclude any of those kind of burns where firefighters just won't train on them anymore.
Yeah.
You answered my questions. Thank you.
Okay. Thank you. Yep.
Mr. Jeff, what was it that you wanted to say to finish?
I was just going to add for the delegate, you could do other types of training like, forcible entry, simulating cutting holes in roofs, things like that. That training could still be done. We just don't want it to be burned. That's all.
Okay. Delegate Lewis. Robin Lewis.
I'm sorry, Madam Chair. I didn't hear you.
Your hand is up.
Oh, that's an error. I beg your pardon.
Okay. All right. I know Nick Manis is here. Nick, are you here? Did I see him?
Yes.
Okay.
Madam Chair, and
Yes.
I just want to thank Delegate Young and also Jeff for working with us. This bill is similar to what just passed in Virginia, and appreciate everyone's cooperation, and we're all supportive, including the wood manufacturers. As Jeff said, they reached out to me also and said with the added language, they're fine with the bill also.
Thank you so much. We really appreciate you working with our members and compromising. You really do that well, Nick. So thank you very much. Any questions from the committee? Any concerns that you have regarding this bill? All right. Thank you, Delegate Young, for working on the amendments, and Jeff, we really appreciate it. Is there a motion on the bill?
Move the amendments.
It's been moved and second. Any questions or concerns on the bill as amended? May I have a motion?
Move the bill as amended. Second.
It's been moved and second. Any questions or concerns about this bill? Seeing none, all those in favor say aye.
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 Any opposition? None. Thank you. Thank you for working it out. We really appreciate it. It makes things a lot easier. Have a
Thank you.
great day for those of you that won't be on the next bill hearings. May
Thank you.
I have next House Bill 1389, please? Thank you.
House Bill 1389 requires the Secretary of Health to establish a Prevent Workplace Violence in Healthcare Settings Public Awareness Campaign Work Group to develop a public awareness campaign on preventing workplace violence in healthcare settings, recognize and accommodate the needs of patients with mental health disorders and substance abuse disorders in the development of the campaign, and create a plan for implementing the public awareness campaign, including distributing information on workplace violence in healthcare setting. In this, there are two amendments that were sent around by Aaron. One of the amendments strikes from the membership of the
Delegate Lewis, Robin Lewis, can you mute yourself, please?
I'm sorry, ma'am. I'm so sorry.
It's all right. It happens and we're tired. Do not worry about it. Sorry, Lisa, go ahead.
That's okay. So one of the amendments strikes from the membership, the work group, an individual who works in a facility that provides services to individuals with disabilities, and also strikes language that would have required the work group to recognize and accommodate the needs of patients with disabilities when making the public awareness campaign. And then the second amendment adds a representative from the Maryland States Attorneys Association to the work group.
Thank you so much. Delegate Bagno, really quickly, why we need the bill.
We need this bill because, well, something that was asked in the hearing was, why aren't we doing more? And we have tried other actions for a number of years, and the urgency has increased, but the action has not advanced. So the advocates are asking us to do this to get, to make the public aware of the urgency of the challenge. Oh, I'm sorry, I'm in two meetings at the same time. I'm sorry, I'm also testifying on a bill in another Zoom. So move to suspend the rules. Okay. Then I withdraw my motion. My apologies, Madam Chair.
Go ahead.
We have a great deal of urgency. The advocates are asking for our help. They have taken as many actions as they can to address this violence in the workplace, and now they need our intervention.
Okay, thank you. Are there any questions? I have Delegate Chisholm.
Yeah, just real quick. We're removing the disability. What did the amendment remove? Can I hear that again, Lisa?
So one of the members, one of the members was an individual who works in a facility that provides services to individuals with disabilities. I don't know if Robin Elliott or Aaron Dorian could explain why we're doing that.
Yeah, so I can, if that's okay, Madam Chair.
Yes.
Okay, so this was requested by the developmental disabilities advocates. It just does not make sense for them to be in this bill. Many of their providers provide care in the home setting. It's just a little bit they have a little bit of a different situation than say a hospital or a nursing home. And, you know, I think when we asked for the bill to be drafted, we wanted to be as inclusive as we could of, you know, as many healthcare providers as we could get under this umbrella. And then, you know, we found out later that this is less of this, not that it's not a concern for the DD community, but they have a little bit of a different situation. And there were some questions around stigmatizing those with developmental disabilities that they were a little bit concerned about. So they asked for a friendly amendment to be removed. That's not to say that, you know, that there's any kind of, we don't, it was just a friendly amendment. I'll just leave it at that.
I'll trust it, but that is our most vulnerable population too, that they're working with. That's why I asked.
Yeah, and this bill is really targeted at looking at violence against the healthcare worker themselves,
Right.
not the other way around.
Yep. Okay. Thank you for the clarification.
Thank you for the question, Delegate Chisholm. That's a really good question.
Thank you, Madam Chair.
My pleasure. So Dorian, tell me why we need this bill in your words.
Thank you, Madam Chair. You know, I think you've heard from the sponsor that you have heard about the issue around workplace violence or violence against a healthcare worker for many years. We've seen it in our hospitals. We've seen the incidences of violence against healthcare workers increasing over the last few years. As you heard the sponsor say, it's only gotten, it's reached a tipping point. I think, you know, I think that we've been talking about it a lot here. I'm not sure that the public knows how big of an issue this really is. And I want to be clear about something. It is not just happening in our psychiatric units. In fact, you know, oftentimes it is a visitor that is coming into a hospital and causing some issues and commotions. And we just think that it is part of what we have. A multi-pronged solution is to make sure that the public is aware that this is happening and that it is not tolerated.
Thank you. Does anyone else want to be heard? Robin.
Good morning. Robin Elliott on behalf of the Maryland Nurses Association. We thank Delegate Bagnall and the subcommittee for consideration of this bill. Before COVID, the Maryland Nurses Association went on a listening tour, and the number one issue that was raised was workplace violence. And this bill is so important because sometimes even nurses have adopted the sort of approach that workplace violence is just part of the job, and it has gotten worse. And we have statistics that show that as many as 1 in 10 nurses are assaulted per year. Certainly this is broad. Other healthcare providers are in this, but nurses are often, you know, they're the largest healthcare profession, and they are often really on the front lines of this. And so we just really appreciate any support in really bringing broader awareness to this issue.
Thank you. Delegate Hill.
Real quick, I know we asked at the hearing, I don't remember that we got an answer. Why can't we just direct them, the state, to go ahead and do this PR and PSAs, and instead of having a committee to come up with a way to do it? I mean, there's documentation exactly what the issues are. That's the question.
Dorian.
You know, Delegate Hill, that is a great question. I think oftentimes when the General Assembly takes some action and elevates an issue to a piece of legislation, it just makes it that much more salient. I mean, we at the Maryland Hospital Association have worked for a number of years with the Maryland Nurses Association on this issue. We've held we've held meetings, we've done, our own campaigns. I think just sometimes it requires that additional push from you all in as members of the General Assembly to get the state to do a little bit more and just to push it that little bit further.
Right, so real quick, Erin, so you guys have worked, the Hospital Nurses Association, have you worked with the state? Have you worked with the administration and asked them to do the PR?
We have in the past asked them to assist us. We have never, this is sort of a new concept for us, this major PR campaign. So we have not in the past, that we have you know,
So
ask
you
them.
never asked them to do the PR. Okay, that's all I wanted to know. Thank you.
Yeah.
Okay. Robin,
So to say, we have worked with the state on trying to improve reporting data. And so we have had various asks to the state, not the specific one, but I do agree with Aaron that legislation would highlight this in a way that just a letter from the chair would not. And that the nurses are very much looking for tangible signs of support. And that's one of the reasons that we would really value a piece of legislation.
well, in the last 2.5 years have been very rough on our healthcare heroes. And this sends a message that this is a priority. And we know that sometimes things do not get done as well. Delegate Riley.
Thank you, Madam. Thank you, Madam Chair. Yeah, I don't know. I put on here that, like you said earlier, we currently have a program, but it apparently hasn't gotten a whole lot of traction. So I understand the reason why the sponsor wanted to do something. But this is just strictly for the employees, correct? It doesn't, there's no safeguards here for the families. This is strictly for nurses, doctors, et cetera. Is that correct first? Yeah.
This is targeted for the healthcare workers because the violence is against them when people go to the hospitals and they're in the ER or it's a psych unit or it's in a patient room. So this is the violence against our doctors, our nurses.
Okay, so for instance, the one that's probably, the psychiatric, the psych area, mental health. I mean, those people are generally unstable as it is. And then they're on medication. So I'm not sure how is this going to work? What's going to happen to that patient if a nurse charges them of something and they're on drugs and they're already, I don't understand what's going to happen.
So, Madam Chair, if I may, this is for a campaign to raise awareness about violence. So it's this isn't. I'm not sure what you mean by safeguards or what's going to happen to them. This is
so
just
basically
about
there's no teeth in this. This is just public information saying.
Public-facing campaign to make the public aware that there is a rise in violence against healthcare workers.
Okay.
Right. There's nothing in it that would create a cause of action against a patient.
Okay. All right. So I guess I'm a little confused then why it's really needed when we already have a program that's similar to it. And just like, similar to Delegate Hill said that they can currently do this, do the marketing. And but thank you for answering my questions. I appreciate it.
Okay. Dorian, did you want to be heard?
Nope, Delegate Bagnall and Lisa said what I would say.
Thank you. So my any other questions or concern? So my understanding of this is that the violence have gotten so bad. I mean, really, really bad. You just have to Google and find the cases. And we have heard it in this committee that nothing that they're doing or have is working. So this is a public campaign like any others when we want to, in public health, raise awareness, right? And these are our people. These are our healthcare workers. They have sacrificed and done so much in the last 2.5 years. So we know that sometimes if we do not make it a legislative intent, and it does not happen at all. So, and Kaiser.
Thank you, Madam Chair. And then the other thing I would say about the need to legislate in case they don't do it is that, and I think it's somewhat what you said earlier, but it's really using the bully pulpit that we have from government to express our values and concern, and as you say, signal. And so I think that's the other value of legislating, even if it's something that we could already do, it is sending a message. So thank you.
Yeah, and I think that we owe it to them after everything they have gone through. And we know that there's a workforce shortage. People are leaving these jobs, and that is part of the reason. We have so many bills in this legislative body right now dealing with that and putting so much resources towards it. So we should make sure that the environment is a healthy and safe one. So Delegate Riley.
Sorry for the second bite of the apple here.
No, it's all right.
So
That's why we're
So
here.
you said you have data. That's why we're putting this bill in, that it has progressed over the last couple of years. Do we have numbers of of cases, and can you give us an example of what kind of violence you're talking about?
Who will be best to answer that, Dorian or Robin?
I'll let Robin go.
So Delegate Riley, because of the way that data is collected, there's a lag time. But we know even prior to COVID that it's as much as a CDC survey of nurses that it was a little bit over 10% had been assaulted in a single year. We know that and I think the hospitals, of course, track information as it happens, that very much from our membership, that how they explain it is that people are, they started off as being heroes, and very quickly, because of frustration with what's happening with COVID, and that now they are subject to the frustrations of people who understandably are frustrated, but unfortunately some people turn that frustration into actual assault. And they're very much seeing that as an increase. They've reported it to us. I would expect, as we see the time lag in the data, that we will see that increase.
So is it like hands-on assault, or it's verbally assault, or throwing something at them assault, or all of the above?
All of the above. It's an even higher percentage if you include verbal assaults, but nurses, or if we think about nursing assistants or respiratory therapists, if it's a patient that's assaulting, if you can imagine, like, they're the ones who are administering to the patient. They're very vulnerable because they may be doing an injection. They may be trying to manage medication or putting on a piece of equipment. They're very vulnerable. They can't even cross their arms if they get hit. And so, or often, it's also family members that come in, or if there has been a violent incident kind of outside, sometimes the violence comes into the ER, unfortunately. So it is the full range of everything we see outside of the healthcare system. It's just amplified in the healthcare system. And it's to a degree that we hear often from nurses who want to quit. And I know that's a hard number to track, but they want to either quit nursing altogether or quit in the settings in which there is a lot of violence. It's emergency rooms. It's actually, believe it or not, labor and delivery wards, because there's a lot of family tension. It's overwhelming to nurses. And so we really would appreciate sort of ongoing support of this issue, including this bill.
Yeah, I'm still, unfortunately still a little uncomfortable, because I'm afraid, you're kind of mixing the rights of the family members, and because it seems like it's family members of the patients in some cases. Now, some probably not so much. So there's a thin line there. Yeah.
If I may, no, there's no rights missing. This is just a public safety campaign. There's nothing in here dealing with in the bill at all.
I get it, but
any issues
what's it going to lead to if nothing happens? I mean, marketing is marketing. I'm not sure how it's going to work.
Okay.
So that's okay.
No,
Thank you.
I respect that. Thank you. Dorian.
Thank you, Madam Chair. And Delegate Riley, I know you're asking about data, and we can get you some additional data, but I just want to point you to our written testimony. There was a report done by the U.S. Bureau of Labor Statistics on workplace violence in healthcare, and they in that report they discussed workplace injuries and result of a violent incident, and 73% of all non-fatal injuries that were reported to the U.S. Bureau of Labor Statistics were from a healthcare setting. That data is a little old. That's from 2018 because the report was put out in 2020, but anecdotally things have gotten worse.
Okay, all right.
Move the amendments.
It's been moved second.
Second.
Any questions or concerns? All right, all those in favor say aye.
Aye.
Any opposed to the amendment? And the bill as amended.
Move the bill.
Second. It's been moved in second. Any questions or concern? All those in favor say aye. Any opposition, please raise your hand. Okay, I see Delegate Riley.
Yeah, for now, I
Okay.
may change my mind, but.
And
give me a
Delegate
little bit more
Shalega.
time.
Oh, that's fine,
Yeah.
Delegate Riley. Thank
I
you.
may change my mind too. I need to do a little more homework.
That's okay. Thank you so much. I appreciate you both. So the bill passes, Delegate Riley and Delegate Shalega. Okay, wonderful. So we're on to, let's do 1471.
This is
Are
an
there any, sorry.
You good? This is an emergency bill that authorizes the Garrett County Commissioners and the Board of Governors of the Garrett County Memorial Hospital to lease the Garrett County Memorial Hospital or any portion thereof and transfer assets incidental to the lease in accordance with terms determined by the County Commissioners and the Board of Governors. The bill decreases from 9 to 3 the total number of members of the Garrett County Memorial Hospital Board if the County Commissioners and the Board of Governors lease the Garrett County Memorial Hospital or any portion thereof. There is an amendment that was provided in your packet that reflects the bill as it passed the Senate cross-file. The amendments deal with the number of the Board of Governors, and if it reduces that number from 15 to 9. I don't know if Delegate Beitzel's on the call, but you did get letters from the Garrett County delegation that support the bill, also from the county attorney for Garrett County and the Garrett County Regional Medical Center, all in support of the bill.
So I have asked the good delegate for the letters, and he did provide us with the letters. Is there any questions on this bill and the amendments? Anyone has any concern about this bill? Seeing
Move the
none.
amendment.
Second. Is it moved in second? Any questions or concerns about this bill? All those in favor say aye.
Aye.
Any opposition? None. On the bill as amended, may I
Move the
have a
bill.
motion? May I have a second? Any
Second.
questions or concerns about this bill? Please tell me now. Seeing none, all those in favor say aye. Any opposition? None. The bill passes unanimous. Now let's go to the final bill, House Bill 1412. And then we're gonna have it here for discussion because there's not enough time to get into it, but delegate, I'm sorry, I'm not going. Erin, I'm not sure you want to be a delegate, but go ahead, Erin, describe the bill.
Bill establishes a Parkinson's disease registry and a Parkinson's disease registry advisory committee to establish a system for the collection and dissemination of information determining the incidence and prevalence of Parkinson's disease and related Parkinsonisms in the state. An individual with Parkinson's disease may opt out of participating in the registry. A nurse practitioner, physician, or physician assistant who diagnoses patients with Parkinson's disease and related Parkinsonisms must report each case to the registry. At least 180 days before MDH adopts mandatory reporting of Parkinson's disease and related Parkinsonisms, MDH must provide notification on its website directly to associations representing hospitals, healthcare professionals, and other healthcare providers in the state, and directly to the State Board of Nursing and the Maryland Board of Physicians. MDH may enter into agreements to share data, and MDH must adopt regulations for the registry and advisory committee.
Okay. Is anyone from the Department of Health here?
Yeah, I don't think we have any representation on this bill, unfortunately. Delegate Kerr was invited. He might have a conflict.
Okay.
I think it's a great bill.
You think
My
it's
dad has Parkinson's. I think this will help him.
Delegate Hill?
Yeah, so these are my notes. I understand it's for getting, wanting to know the incidence and frequency, but I'm really not sure what the purpose beyond that is. I'm also not sure why it would be Parkinson's only and not other debilitating neurological and neuromuscular diseases like ALS and MS. I'm not sure why we're focusing on Parkinson's when we've got, and what would then come out of the registry. And so since it's some mandated reporting, in addition to reporting every incidence of cancer and blah, 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 I just want to have an understanding of why this particular illness and not, again, ALS, multiple sclerosis, other kinds of things, and what are we doing with the information?
Okay. And that's what I thought would happen, that there would be questions like that. Delegate Chisholm.
Mine's just a point of clarification for the committee, just so they know, because I was concerned about the confidentiality, but it does say in the bill that that they have to get written permission to maintain confidentiality, and whoever is providing that data has to give written permission, because I was concerned about some of the privacy issues, but it looks like it is addressed in the bill.
Thank you. Thank you.
Thank you.
Thank you for pointing that out. So are there any questions? We're gonna hold the bill and see if the delegate will be available and get some answers, more answers that Delegate Hill has, but I'm going to allow some more conversation, Delegate Kaiser and then Delegate Shalega.
Thank you, Madam Chair. I kind of, both what Delegate Hill and Delegate Shalega said. As with Delegate Shalega, I support this not because of a family member, but the belief that always good data can lead to good decision-making. And I think that's important. But as with Delegate Hill, I'm wondering why this and not other things, and why is this something we don't already do? So, I share both concerns. But again, what are we going to do with the data ultimately? So that's a question for later, I guess.
Yeah, I think
Thank
I'd
you.
like to hear from Delegate Kurt and the department as well. Delegate Shalega and then Delegate Lewis and then Delegate Hill.
Thank you. You may recall the Julia Wooster came from the Parkinson's Michael J. Fox Foundation.
Yes.
And I've talked to Julia about this bill. The Michael J. Fox Foundation for Parkinson's Research is the one behind this. So they're the ones that are trying to get support for this across the country. And that's why it's just Parkinson's, because they're the research arm of, the Parkinson's disease, the Michael J. Fox Parkinson's group, and hence why they're moving this and not some of the other neurological diseases that are, like ALS is devastating as well. But that's why it's that. And I bet Julia would have been on this call had she known. I'm sorry I missed it. I would have emailed her and asked her to join.
Okay, thank you, Delegate Shalega. Delegate Hill.
Okay, and I'm looking at that letter and I see that, and I guess it would, I think the options for us, and if we're going to move this bill, is whether we add these other registries to it, just the same people making the diagnosis if they have to report. But I think the other thing is that with a lot of diseases, it's actually the advocacy groups themselves, particularly since this is voluntary participation in the registry, but a mandate for the providers. That people sign up with these groups themselves, they self-report. And so oftentimes it's the advocacy group nationally that has the numbers. That's where we go to find, that's where we get our numbers about how many people actually have a disorder or disease. So I just wanted to add that to the discussion.
Thank you, Delegate Lewis.
Thank you, Madam Chair. I just wanted to mention, as the MPH degree holder in the committee, I think I'm the only one. We study epidemiology and diseases. Most diseases are reported to centralized national databases. The Centers for Disease Control and Prevention maintains disease registry, and they issue a weekly report, which is called the MMWR. which is available to the public. And I also, because Parkinson's is a devastating but somewhat rare disease, I just wanted to double check that it was reported. And in fact, the CDC's MMWR, the Morbidity and Mortality Weekly Report, which is again publicly available, does provide quick statistics, overviews of disease incidence and prevalence. And I'm not diving deep, there's probably state level data. This the page I'm looking at now is national summary, cumulative national data, but it is available. So I'm not sure what the purpose of a registry would be other than for the purpose of advocacy. And the second thing I'll just mention is that, as Delegate Hill stated, a registry like this would be driven by self-report. There's the bell. And so it's not as if it's capturing the entire universe of disease prevalence. So I'm not really sure why this is needed.
So I'm going to hold the bill because we have a lot of questions and there's some people that should be in the meeting. So we're going to hold it, and we got through our agenda. Thank you so much.
Madam Chair, before we leave,
yes.
I know the bell's ringing.
Yeah,
Just
yeah,
real quick.
they have.
Right, but real quick on the young bill with the board, I just wasn't clear if a lot of fire departments burn existing buildings that are dilapidated, do they have to strip the board off the roof before they burn that building? I mean, it's not always, they're controlled burns that they do at buildings.
Delegate Hill, why don't I give you Jeff's number and you talk to him and he'll answer you, okay?
Or talk to me on the floor, Terry, because I asked all those questions.
Because she asked the question and he addressed them, okay? Thank you. Bye-bye. Thank you, everyone.